And Professor Pekosz, you're wearing a mask. Why are still some people questioning mask wearing?
It's a difficult thing to understand, to be honest. New CDC guidelines suggest that we should be wearing masks even at the workplace, as much as possible. I'm currently in my workplace, so I'm wearing my mask. We've seen record number of cases a week after Thanksgiving. 2 weeks after Thanksgiving, we're now seeing record numbers of deaths here in the United States. These are things that we knew were going to happen. These are things we know how to prevent. I think it really needs a much better commitment from top to bottom here in the United States, from the government levels down to personal responsibilities, to try to make a dent into this incredibly dangerous pandemic.
Dr. Pekosz, will people relax the rules too much or feel like they won't be affected because we're, a couple of days or weeks away from a viable vaccine being approved in the U.S.?
Yeah, I would hope not. The realistic expectations for this vaccine is that it really won't be making a dent in the population, in the general population, until sometime in the next calendar year. The FDA hearing yesterday went extremely well. The plan to roll out the vaccine in frontline healthcare workers and in residents, elderly residents in communities is all in place. But the vaccine supply is going to come through in a measured manner, and it really won't be widespread distribution for some time now. We have to do something now to make a dent in the cases. We can't wait for the vaccine to come by and do that.
I mean, some of these vaccines are not recommended for women who are pregnant, for children under 12, for people with severe allergies. Why?
Yeah, so this is the next most important question that we're going to have to start addressing. The Pfizer trial and I think the Moderna trial that'll be coming up to the FDA next week, both focused on individuals between the ages of about 16 and up to 90 years of age. What was excluded from those groups are children under the age of 16, pregnant women, and several other groups. That's not to say that the vaccine has some sort of extra concerns in those groups. It's just that they haven't been studied yet to make sure that the vaccine is safe and efficacious in those groups. What the FDA clearance allows us to do is now sort of say, all right, the vaccine has shown efficacy, it has shown safety, and we can now move to some of these other groups, which are incredibly important to immunize. Pregnant women are a perfect example of a group that is oftentimes avoided in clinical trials, but is incredibly important to vaccinate and protect in a pandemic. We'll be moving to those groups relatively soon as we get more data for safety and efficacy in those groups, now that we have the first signals of both in the general population.
Rich Western countries have enough funds to buy the vaccine 3 times over. What happens to countries where, the treasuries don't have that kind of access to funds?
Yeah, it's a very important question. There are several initiatives that are going on to make sure that we get a global distribution of vaccines. We have to remember here in the U.S., in Europe, we can deal with the pandemic here, but we have to deal with it globally, because otherwise we'll continue to see cases and we'll continue to see this virus spread. We have to have a global response to make sure that we tamp down infections everywhere. And places that are economically disadvantaged need to get the help to be able to distribute vaccines there effectively and safely, because that is part of what we have to do in a global pandemic, is address these issues globally.